This research project is by myself, Luke Braffa, and is on the topic Down syndrome. Down syndrome is a genetic disorder that happens to humans when they are born with 47 chromosomes instead of the regular amount, which is 46. In most cases of Down syndrome, it occurs when there's an extra copy of the 21st chromosome. This type of Down syndrome is called trisomy 21 and happens during cell division. 95% of people with Down syndrome have this type of Down syndrome. This extra chromosome affects the way the brain and body develops over time. There are two other types of Down syndrome, mosaicism and translocation. Translocation occurs in about 3% of cases of Down syndrome. Translocation happens when the 21st chromosome breaks off and attaches itself to another chromosome. In most cases, it attaches to the 14th chromosome. Mosaicism occurs in about 2% of cases of Down syndrome. Mosaicism happens when there is an error in the separation of the 21st chromosome in one of the first cell divisions after fertilization. There are many different symptoms someone who has Down syndrome may have. These symptoms vary between people. One common symptom people with Down syndrome share is that their head is usually smaller than normal or abnormally shaped. Some common physical symptoms include decreased muscle tone, excess skin on the neck, flattened nose, small ears, small mouth, slanting eyes, short fingers, and white spots on a part of the eye. Someone with Down syndrome usually experiences slower physical development and might never reach adult height. Some common mental disabilities include poor judgment, slow learning, short attention span, and impulsive behavior. People with Down syndrome will have slower mental and social development. Special education is offered in most communities for people with Down syndrome or other disorders to help them live with the delays in mental development. Certain tests like the echocardiogram, listening to the heart murmur, a blood test to check the amount of chromosomes, and x-rays of the chest can be used to identify someone with Down syndrome. Someone with Down syndrome must be closely monitored for medical conditions. They have to have hearing tests every 6 to 12 months, eye exams every year, dental exams every 6 months, thyroid testings every 12 months, and x-rays of the upper or cervical spine between the ages of 3 to 5. There is no treatment for Down syndrome, and people who are born with Down syndrome might immediately need surgery to fix heart defects or gastrointestinal blockage. Women over the age of 35 have a greater risk of having a child with Down syndrome, as well as couples who have already had a baby with Down syndrome. Down syndrome is the most commonly occurring chromosomal condition. 1 in every 691 babies in the United States is born with Down syndrome. There are more than 400,000 people living with Down syndrome in the United States. Down syndrome occurs in people of all races. Life expectancy for people with Down syndrome has increased dramatically in recent decades, from 25 in 1983 to 60 today. Quality educational programs, a stimulating home environment, good health care, and positive support from a family, friends, and the community enable people with Down syndrome to develop their full potential and lead fulfilling lives. Thank you for watching and have a nice day.